without insurance, sorry, I could have just started that later. um, for those without insurance, we have a sliding fee scale that is based on income and family size. Um, and we do have some like assistance if someone can't afford the copay for that. One of the biggest things that I'm part at the clinic is we have what's called a care coordination team that is encompasses of case managers, community health workers, social workers, and nurses, and we focus on the social determinants of health for our patients, and it's free. And we run a few programs at the clinic for our patients. We have what's called a VeggieRx program. We also have what's called a medical MLP or medical lab partnership, like a legal aid program for our patients at no cost, of course. Aside from our medical services, we have 3 social services programs. One of them is called the Crisis and Information Hotline. We are part of the 988 initiative. The hotline is managed 24/7. It provides crisis intervention and community resources. And at times we have financial assistance for like a medication copay or utility shut-off assistance. We also have a HOPE, which is a day center for adults who are either unhoused or at risk of becoming unhoused. They can come in there, they can shower, they can do laundry, they can get a hot meal, they can see a primary care doctor, no insurance, we don't verify insurance, get case management and all the good stuff. Of course, if they don't have insurance, we'll help them apply for insurance and connect them. And then, so that's for adults. Then we have hosts, which is our day center and transitional program for those who are between the ages of 18 and 24. Same thing, they can, shower, do laundry, hot meal, get medical care, case management. No need insurance, but we'll help them get insurance if they need to. So the social services programs are open for anybody. And so that's, I was trying to do it under 5 minutes. I will post the website to our services on the chat where you can find more information about all our programs. All right, thank you so much.
Memo, that was a lot, and I appreciate you moving right along when I started the recording, because I forgot to do that, of course, at the beginning. We're starting to record these messages, so I appreciate your flexibility on that. And don't worry, Sochi, who's normally with me co-hosting, she just had to, she just couldn't make it. And so we're all good here. There'll be a couple other changes in the agenda as well. But before I go on, then I want to let our other community partner introduce herself and her organization. So Jackie, if you can take it away.
Hi, everybody. Yay, I also have screen share, right? So I'm going to do that real quick. So my name is Jackie Leung. I'm with the Micronesian Islander community. It's good to see you all. So a little bit about the Micronesian Islander community. We're a 501c3 nonprofit organization based in Oregon, providing services primarily to Micronesians, but also to Pacific Islanders in Oregon and back home on our islands. Our service has since expanded to anybody within the 50 states, specifically people who are Micronesian COFA citizens, but also to Guam and the CNMI territories. And our organization first started in 2012. So some of the things that we provide, a lot of it is service navigation for CHWs, DV, so domestic violence prevention courses and discussions, as well as diabetes prevention, prenatal healthcare access, doulas, and other service navigation. We've been doing a lot of COVID-related work, so mask, cleaning supplies, housing support, food boxes, grocery delivery, and COVID-19 wraparound support. We've also provided, through our partners, access to COVID-19 vaccines. Through our community-based partnership, we are community partners to provide OHP Medicaid enrollment and also disenrollment from the COFA Premium Assistance Program, which has since ended. Other services, we do notary services, both in person and virtual. We help people get access to the I-94, how to access it, and in certain cases, be able to help them partial payment towards their new replacement for an I-94, which actually costs $440 to get a new one or a replacement. We can't cover it all, so we only cover a portion. In partnership, we also provide vision and dental clinic services, support at CHWs, and also we're getting ready to restart our diabetes prevention program services. Some of our main important activities is our back to school resource fair, which we've had now for 3 years, other than last year, or no, the first year because of COVID. So 2020 was a year we skipped, but otherwise we've been consistent about it. And we also have our MIC Cultural Day, which is actually this Saturday in Salem. And we also do job training specifically for people who want to be community health workers and for people in our community who are interested in becoming healthcare interpreters. We do have some scholarship money to cover that. We also provide peer support services as well as doulas who are ready to provide doula services to members of our community. I just want to show some really quick pictures of some of our outreach events. These are some from doing food boxes as well as working with the food pantry, providing food to members of our community. This is when in Eastern Oregon, we had a huge toilet tissue situation, especially in the early days of the pandemic. We were able to find toilet tissue from a place called Who Gives a Crap. It was an Australian-based organization that was able to ship toilet tissue to our community in Eastern Oregon, specifically La Grande. And so they were able to give it to students as well as to members of our community. We also provide support back home on the island. So this is a photo from the Marshall Islands, food access, as well as Pohnpei, and ending it briefly with a quote from a distinguished member of our community who has since passed on, Vaitsonis Ekis mi Ekis, which in Chuukese, it translates into little by little. Thank you.
Thank you so much, Jackie and Momo both. Any questions for either of these organizations? They obviously do a lot in the respective communities, so we want to thank them. Back to see my pauses. Very good. All right. Well, I'm also, if you do have questions, you can see the links that they've each placed in the chat. You can reach out there. And in the meantime, I'm very happy to turn it over to the Oregon Eligibility Partnerships Director, Nate Singer, for an update. Nate, take it away.
Will do. Thank you. And that was just great information. I'm taking down notes on the side there, so I will take a second. Jackie, I hope you're connected in as they're building out the COFA dental program and some of those pieces we continue to build out there. So I assume so. I was already just checking there, so just appreciate it. And Memo, being in Salem, always appreciate all the work and supports you provide here in my community where I'm at. So appreciate it. I'm going to share usual updates to you all. I'm going to go through some of the slides you see regularly pretty quick here and just try to get you all onto all your other topics. But I'm going to share my screen and want to make sure that I'm giving you the right information. I apparently have forgotten how to share my screen. There we go. All right. Here we go as we move through it. So want to just cover again several of the things that are happening as we continue to look at the one system and also eligibility. So when we talk one system, I always just want to refresh. This is for all medical programs eligibility, our food assistance, so supplemental nutrition assistance program, our cash programs, so temporary assistance for needy families, or domestic violence services, and our child care services, those was employment-related daycare. So there's a lot of eligibility in here. For those that don't know, we're serving almost 1.5 million Oregonians right now through this. through the one system. That's 1 in every 3 individuals in this state are actively receiving a benefit through the one system. That doesn't count all the people that continue to come in. In August alone, we did 67,000 new applications, not to count all the redeterminations and changes and other things that we continue to try to process through there. So some of the things we've done is we continue to work through our applicant portal. This is an area that over the next years, and I say years because it's an ongoing process, I look forward to engaging with you all in other forums, this forum and other places around how we can improve the applicant portal. Our goal was to get technology out, especially with the pandemic, so we can be supportive of individuals when they were at home or needing to communicate. But we know there are better ways to be able to do this. So we've been collecting feedback from individuals and are looking forward to a time that we have enough stability and calm to be able to begin some of this work with our communities and partners to be able to say, how can we better improve access for individuals? But what we have done thus far is really create the ability for eligibility workers to create an account on behalf of someone else. So when you come into an office and someone says, you know, I'm trying to set up an account, and we say, oh, go set up an account, that it can be complex for individuals for a lot of different reasons, technology, communications, the steps, and there's some federal requirements that make it difficult. And so our workers can actually initiate it, coordinate with the individual in a secure way, so that way we can help establish that account for them. One of the other things is reinstate without application when information is verified and submitted. So as we do this workload, there are times that we get through things, and whether it's Oregonian ourselves, there's a lapse of benefit. And as we do this, normally we need to go back in there and take all these steps to be able to collect these applications and reestablish the case. We, for the SNAP program, are able to now reinstate that application within certain timeframes when we have those areas, as long as it's been the last 2 months of certification. So we can do some steps to be able to more quickly get you and or whoever we're serving the correct benefits. As we've called out before, we now have up to 16 languages on our 800 number, so people can call through the interpreters. We are tracking that to see usage and looking at opportunities to better message that out there, so that way people can call and specifically be connected in with interpreters and be able to get through our 800 number. You'll see some call time information in just a moment here. The TANF tri-annual clothing allowance that the legislature approved is going out there. You all heard about that in recent meetings, so I won't continue to cover theirs. You've heard about some of these things, but those will be going out to individuals. And we hope to this month, if not next month at the latest, be able to turn back on callback options within our 800 number. So instead of waiting on hold as we talk about call times, people will be able to choose, and the system will hold their spot in line where they were and call them back, so that way they don't have to use their time in minutes or just sitting there waiting for us while we have what is just historic demand as we serve individuals. You've seen slides like this before. This was updated. Luckily, the gap that we would be seeing here was assuming not only all the open enrollment things that happen, the effects of as we continue to work towards able-bodied adults without dependence. I had to think there for a second. And some of these federal requirements that are changing for us, those have been pushed off. So our implementation dates for having to do some of the things have been pushed off by a few months, or we still don't know when the public health emergency will end. But what this shows, and generally for your awareness, is that we expect the number of tasks and work that we have to do just to significantly increase. Right now, technically, we don't have to complete all the medical redeterminations. We continue to see application numbers increase or maintain where they are. And so as we continue to try to do this work, we are doing everything we can to think about IT solutions, things we can fix to make easier, partnering with community partners, similar to what was already just shared with you around the community partner network, but how can we expand that to other programs and support, and look at ways to request staffing, so that way ultimately we see as little effect to Oregonians as possible is what we're trying to avoid. When we talk about effect for Oregonians, here's where we are as we talk backlog. So right now, we have continued to see our backlog past due applications drop. Again, these are not the same applications from December 2021. These are past federal processing deadlines. Our goal is to process your application the same day or the next day. We want to process when we get that application as soon as possible. Sometimes based on the information we have, our staffing, or just demand, we can't do that. But these are tracking where applications got past their current due dates. So you can see where the trend has been. We are starting to see an increase there. We expect to see an increase in August. Normally it's a time where we have less staff available to us. We also see higher demand as individuals engage with their family, as people prepare for school. And so we just see different demands also as different workforces. As you think about seasonal workforces start to end, we usually see some things starting to come in at different peak periods. And so depending on how those things shift, as we look at across history. What you see there is about 4,300 so applications past their federal processing deadlines. That doesn't mean they're not getting benefits. These are applications, so they will get benefits back to those dates. The deadlines can be up to 24 hours for domestic violence areas, a few days for expedited SNAP, or up to 45 days when we think about the Oregon Health Plan. Again, we're working through these. It may be that we're waiting for information from an individual. And so we'll talk about some things that can do to help, and just reminding you as you get a chance to remind partners around this. I want to spend a second as I run through the slides with you all to make sure I transparently share this. Our 800 number, the number of calls we have, when I say historic, I keep saying that. I'm afraid it's going to start to just be a line that people feel like I say. So I'm trying to find new words. I will go to my thesaurus and find new words, but we are serving more people than ever. We're seeing demand in more ways than ever, and that includes call volumes. We're just receiving more and more calls as we look at this. And so you can see in August, our average wait times for eligibility were 18 minutes. Support staff calls, that's usually the first part of triaging calls, was 44 minutes for average. And for those calling in for questions or needing help logging into our applicant portal, it was 15 minutes. I always want to share maximum wait times because you all hear it, we hear it, and I want to make sure you hear the truth and the full part from us. Eligibility maximum wait before we answered for someone in the month of August was 213 minutes. If you haven't done the math across on that, 180 is 3 hours. And so it's 3.5 hours someone waited before they answered. Our support staff is close to 3 hours there that we looked at in almost an hour for applicant portal. No, this is not our goal. This is not where we want to be. We continue to request staffing as we look at this. We're looking at technology things we can add to phones to simplify. People can continue to go into local offices. You can apply online and do other areas, but we're just getting a lot of calls right now and a lot of people requesting a lot of information. We brought in a vendor, PH Tech, through the Oregon Health Authority's contract that are helping answer calls. But of their calls, almost 70% of calls have to still be redirected to an eligibility worker right now because they require the state to take action. So you can see the type of calls we're getting aren't just questions that unfortunately we can quickly answer. It's complications of updates, moves, contact information to determine their eligibility for individuals as we process what are the highest numbers of information that we have. Again, my goal will be we'll continue to report max wait times to you all and transparently around what we have, even with virtual hold. So hopefully someone doesn't have to wait 2 hours and 13 minutes actually on the line, but I still want to know when they called in, even if it was virtual hold, how long till we called back. And that's something we want to report out and be able to talk about. The other area to point out is that while normally we look at about 40% of calls where individuals drop off before we're able to answer them, in the last 2 months, that's been closer to 50% of calls. So with these wait times increasing, we are seeing people quit on us before they can get their questions answered, and that's always a concern. So those are areas we're looking at how we can bring in some additional technology and resources to be able to mitigate that. And we'll be talking about those in upcoming months. The other area I want to make sure you know is I've mentioned it here. And as we think about CROSS, there's several major federal things happening. There's always a lot of things happening there as we look across with partners. But one of the areas we want to make sure you're aware of is with the Oregon Health Authority and ODHS, we have a combined monthly partner webinar series beginning. The first session is September 20th from 10 to 11 Pacific Standard Times, specifically for all my partners that are in Mountain Time. As we look across the state, I always like to remind we have 2 time zones in the state. So as we look at this, what it is a chance for community partners, coordinated care organizations, providers, insurers, others to really be able to hear from that partner provider area what's happening around unwinding the public health emergency. For those that aren't aware, as you think about this, for medical applications, individuals haven't had to technically do a redetermination over the last 2.5 years. If there was a negative outcome that could have happened to their medical benefits, we maintain the current benefit level for people in most situations. So individuals, when the public health emergency eventually ends, whenever the feds give us that, we have 60 days of pre-notice, and then we begin doing redeterminations. And so it's really important that individuals understand and that our provider networks understand how important it will be for people to respond to us at that moment when for years they may never have had to before do a redetermination normally. And so we want to make sure we're supporting Oregonians as much as possible that they can have a smooth transition. If someone's no longer eligible, if they qualify for a different type of benefit like a Medicare savings program, we want to be able to provide the best customer service we can, while we will during that time do more redeterminations than ever before. Another historical marker, but we will be redetermining more medical benefits plus all the SNAP, plus all the other programs during the same periods of time than ever in the history of the state. And every other state will go through a similar area as we go through this. I see a hand up already. I know there's one in the chat. Please. Is it Melanie?
Yes, thank you. Are you guys planning, I'm just gonna make sure I have this right in my head. Are you planning on doing redeterminations for everybody?
We must do it. So CMS, the requirement is we must do redeterminations for everyone. Now, when we do that, for medical, we can do passive renewal still. And so that means we send it out, we ask if there's changes, and if we can verify it through our federal databases, we don't have to physically talk to or collect or finish the renewal processes. But we are required to do redeterminations for all individuals and all medical over 14 months. So we have 14 months to do it in. The problem with that is we've given extra time for people to get information back to us because this is their first time. They might be having to gather more documentation as we go through this. That means we have to do what we would normally do over 12 months in 10 months. We actually have to start these and have started and done all medical within 10 months instead of the normal year. So that way there's enough time to finish it because we're federally required to complete all redeterminations once it ends, the public health emergency ends within 14 months. Yes, that wow you said is, I cry in my sleep and spend a lot of time with partners and others thinking through, that's why we want to communicate. That's part of this, is to really help make sure people are aware. We're also working with partners just really quickly here to remind people to update their information with us. We send out a lot of notices. We want to improve our notices. We appreciate everyone that keeps sending in comments. And then we just had a good conversation with another state with some ways to collect comments from you all that we hope to look at and see how we can engage with you to say, how can we improve communicating in ways that actually matter? It's always hard when you have legal requirements and government language to get to real world language. And of course, in every language. We also know we have delays, and just sharing, I want to share openly with you all. We had envelope shortages before, something I never thought we'd deal with. We seem to have made it through that. Now we're dealing with translation delays. So our translation providers, some of y'all, you may experience this as well. And I didn't look at who all's on here. Some of you might be from our translator groups as you work across in this. We're seeing delays in getting notices out in other languages right now because of going through translations. And so we are working on each of these areas to try to make sure we're prepared. So that way, again, as we get through this, every individual gets the right chance to have the correct determinations, understand their due process, and get the right information. So as you engage with people, there are multiple ways for them to get their information. We do need them to read their notices. I know their government forms. I know what I do sometimes with my information when I get it. We do need them to read them. We're going to find ways to get this out there. There'll be media campaigns and other things, but this will become more and more important as we do this work. I am over time as always. Sorry, James. Sorry, everyone. And in the chat, it's not on me. All right. Any other questions really quick? All right, I will say just in closing, thank you all for your work. I really do love listening in. I check in through the chat. You'll see me drop off on pieces, but I just love listening to this information. Appreciate being invited here. We do have things that are coming. I look forward to that. I just want to be open and honest with you all. The next year or two are going to be some of the hardest in my history of this department as we look to support individuals. I'm grateful for all the benefits we have done. I'm excited for the work that, our partners with self-sufficiency and their programs are doing to make sure we can get, food assurances and other things out there, medical and all the things that you all deliver and support every day in our community. So I'm excited to do it. It is going to be a lift. It's going to be rough. And so I plan to come here. Please tell James, tell others what you need from me. If you need to come, just yell at me. I can put my contact information in there. Truly, I do appreciate hearing it. It's how I hear, it's how I know what we need to focus on. So I appreciate getting the time with you all. Thank you.
Yeah, Nate, there was one last thing. Maybe it's something we can talk offline about communication strategies, since I do know you also need to run, but.
Yes. I think that's a great topic. We will bring that back because there's people that will speak to it better than I can. So there's actually a joint group across. And in fact, where I'm going to run to is make sure today I can connect the group that's working on some of those changes I mentioned around SNAP and the federal requirements around able-bodied adults without dependents. And them wanting to send out communications while we send out communications around the public health emergency and making sure those groups are talking together so we don't blast out 4 million pieces of mail to individuals saying to come in and do similar things. So we'll talk about those, but also the various strategies they're looking for. And it'll be a great chance for, I think, them to get some input from you all on what are the right communication avenues as we do this work and how can we be partnering. So we will get that prepared for next time.
Well, thank you, Nate. And before we transfer on over, I want to thank Pamela for her perseverance to give us our ASL interpretation for this meeting. I neglected to send the updated link out. So thank you very much for sticking through and joining us. And in the meantime, I want to turn over to Leanne Knapp from OHCS, Oregon Housing and Community Services, who can give us, for this audience anyway, something of an overdue housing update.
Great. Thanks, James. Hi, everyone. My name is Leanne Knapp. My pronouns are she and her, and I'm a government relations coordinator here at Oregon Housing and Community Services. Want to appreciate Nate and his update as well. There is also a lot of change happening here at OHCS and in our housing work. So I have 3 main updates that I wanted to share with folks today. So the first, and probably one that folks might be most familiar with, is around the Oregon Emergency Rental Assistance Program. So you may have heard about the ongoing work that OHCS has been engaging in to provide rental assistance to Oregonians across the state. As of August 12th, 2022, this year, the Oregon Emergency Rental Assistance portal has been closed to all applications. So prior to then, we were open to recertifications for individuals who hadn't maxed out their the maximum of 15 months of assistance that's federally allowed, or to folks with incomplete applications who needed additional support completing. Maybe they had started their application but hadn't had the chance to finish it. But now the portal is completely closed, and we are still continuing to process applications as funds are remaining, but we're not accepting recertifications, incomplete applications, or any new applications at all. To date, OHCS has provided over $398 million in emergency rental assistance to over 62,000 households since May of 2021. Oregon's actually ranked first in the nation for the percentage of emergency rental assistance funds that we've paid out to folks across the state. So we're really proud of that work, helping a lot of households, but we also know that as this program begins to wind down, there is still a lot of need in terms of housing supports and rental assistance. OHCS also received $100 million in December of 2021 for eviction prevention supports. So a big portion of that is being distributed through our community action agencies and local partners across the state at the local level. So if you know folks or are working with folks who still need rental assistance and still need support, that is available at the local level. So to access that, folks should call 211 or contact their local community action agency directly. So I'm going to go ahead and drop that information in the chat. And we also kind of want to just give folks a little bit of forecasting around what's coming up as OERAP winds down. There's still more protections that are also winding down. So as of September 30th at 11:59, emergency eviction protections for Oregon tenants will also be ending. So that means that protection from eviction for non-payment of rent for people who have pending rental assistance applications, either at the state level or the local level, will be ending. It also means that the 10-day window that was previously open, where landlords had to give notice before providing a notice of termination or an eviction notice to tenants for non-payment, will also be ending and returning back to 72 hours. So effectively what that means is that the window of time that folks will have to be able to respond to an eviction notice and pay that amount that they owe their landlord before kind of entering the next phase of eviction will be significantly shorter. So it'll be more important than ever that folks are connected with community organizations and getting the support that they need. I see the question in the chat. Those protections will end September 30th at 11:59. So as of October, those emergency eviction protections will end. It's really, really important. I'm going to share another link in the chat. One of the most critical resources that's available to folks right now is the Eviction Defense Project, which is being led and supported, coordinated by the Oregon Law Center. Eviction processes don't just happen kind of within the landlord-tenant relationship. They're legal processes and they're filed with the courts, which means that folks need access to legal support when they're undergoing an eviction process. We try to tell folks it's really important. If you don't get the notice, don't just leave, go through the legal process. There is still potentially an opportunity for you to get support and to be able to stay housed in the place that you're living. So Oregon Law Center is doing an immense lift and an incredible amount of work to provide that support through the Eviction Defense Project. So the moment that someone receives an eviction notice from their landlord, they should try to access that local rental assistance and then contact the Eviction Defense Project to get connected with a lawyer who will help them provide that free legal support. So it's a really, really critical resource for folks. So if you're able to continue to help us share that out and get the news out about eviction prevention and the expiration of those policies, that'll be really helpful. And maybe you want to pause there. That's kind of a big piece of information and news. If folks have questions. Okay. I'm going to go ahead and move on to the next topic, but if you were thinking of things, I'm also going to drop my contact information in the chat towards the end to continue the conversation. I also wanted to provide updates around the Homeownership Assistance Fund, which has the goal of preventing foreclosures and displacements for Oregon homeowners with lower incomes who are at risk of losing their homes. So this can look like folks who are in active foreclosure. It can look like individuals with private mortgages or ITIN loans that are over 120 days past payment, folks that are at risk of foreclosure, or folks who are aging, disabled, who live in rural communities, communities of color, folks whose primary language isn't English, or folks who've been displaced due to a natural disaster, who have past due payments and need payment support to avoid foreclosure. So there are resources through Oregon Housing and Community Services. We've also been working with partners to get the word out about that program. And I'm going to go ahead and drop information in the chat as well. So those are the updates around the Homeownership Assistance Fund. And then just finally wanted to, for folks who are interested and want to engage in the conversation, OHCS has submitted our agency request budget, which outlines our budget asks for the 2023 to 2025 biennium. So if you want to learn more about the funding that OHCS will be requesting, we have received an immense amount of funding from the federal government and from the state government over the last couple of years to support housing efforts, and are going to be working to continue and uplift those systems and be able to continue to build them out to support Oregonians and their housing needs. So if you want to learn a little bit about what we have going, how that might interact with your work, if you have questions, I'll go ahead and drop both our snapshot of our work in the chat, and then again, I'll share my contact information. In terms of next steps on that, after agencies submit their budget, the next governor will release the governor's recommended budget, taking into account our requests before the 2023 legislative session. So I'm sure there will be a lot more conversations on budgets and advocacy and ways that folks can support both OHCS's work and other agencies as well. So I will share our budget requests in the chat. And just leave it open for questions.
And I'll be sharing our budget requests later in the meeting too. So thanks, Leanne, for doing that.
Great. Well, I will, like I said, I'm going to put my email in the chat. You're welcome to reach out to me if you do have questions about some of the shifts that are happening around rental assistance or legal protections that are unfolding over the next month or so. Please feel free to reach out. James, I'll try to share information with you as we have materials and updated information to potentially get out to this group, and folks are welcome to touch base. Thank you, everyone. I appreciate your time.
Thank you, Leanne. So we'll move to other policy updates, and in a sort of a shocking development, we don't really have any meaningful SNAP updates to share. So we're going to move right over to TANF, and one of our newer policy analysts, Vicki Partridge-Hilland, has an update or two to share.
Hello, everyone. I'm Vicki Partridge-Hilland. I'm a newer TANF policy analyst. I started in April. I just wanted to share an update about the non-recurrent short-term payment that's going to be going out on or around September 20th. It's for a clothing allowance in the amount of $270, and it's for families that qualified for TANF benefits in August. So I just want to let everybody know those are planned to be going out, and our families can utilize them. And that's my brief update. Does anybody have any questions or anything for me?
I know this is something that we've been talking about a bit, and it's now finally happening. So it's very exciting for every TANF family to get this flat amount.
Yes, I'm excited for our families, definitely.
One thing that's nifty about it is it will not affect other benefits. I suppose it could, in theory, affect a resource limit, but that seems incredibly unlikely to me. So, in effect,
You're correct. It doesn't affect any of our self-sufficiency benefits.
Any other comments or questions on that?
James, will that affect SSI? Let's see, if they're on TANF, they're not on SSI, so that would not affect any SSI benefits, correct?
So a parent can receive TANF benefits for their kids if the parent themselves are receiving SSI. from what I understand, it doesn't affect SSI benefits, but I would have to double check with the rest of the TANF team. But I don't think it is going to.
In my slow processing operating system called this aged brain, I think you're correct. I think you're right, because all that is for the children, and yeah.
Yep.
Thanks.
Definitely. Thank you.
Yeah. Do all recipients know it's coming?
I'm not sure. I think that there might have been communication about that. I know our family coaches are aware of it, and there's been a transmittal issued out to all the family coaches. So if the family coaches have talked to their participants, and then they should be aware of it.
Yeah, thanks. The reason I said that is because I heard a conversation of our participants here at Metro talking about this and their children. So I was aware that some people at least know it's probably or is coming, and they're excited about it for their family.
Oh, good. I'm glad to hear that.
So this is Annette with TANF policy, just to jump in and help Vicky out. So yes, notices are going out to families. Those are in process right now, and they should receive them before the actual payment takes
Nice.
place.
Nice, great.
Thank you, Annette.
Any other questions? And if you have something you want to share, start thinking about that, because I have a few announcements I wanted to make. But as I alluded to earlier, we do have our agency request budget is out, and there's, you know, if you're looking for some reading material, it's only about 1,800 pages in total. Here's a nice launching pad for the link. And I promised our policy people we were going to talk about it, the policy option packages this month, and then I completely forgot when I was creating this agenda. But we will be getting into that because, as was mentioned before, you know, our agency request budget is public, and we love to make sure people know about what the thinking is, and hopefully it incorporated some of the ideas we get from you as well. And you can see it in all its bureaucratic glory on those pages. But of course, keep in mind, as an agency, we work for the governor, and we won't know who the governor is for a little while. And then that new governor will get handed, this is my understanding, it's such a strange process. Instead of the normal November 1st or December 1st publication of the governor's budget, of course, with the new governor coming in, new governor will have until February 1st to post her budget. And the outgoing governor just simply gives them in private what they suggest, but of course the new governor can do whatever they want. So we won't know exactly what we get to work on, in effect, especially when it comes to the legislature until then, until that February 1st deadline, presumably. But as always, we can be a resource to you, answer your questions, but it's providers and advocates, we rely on you often to uplift what the people we serve need. So I just wanted to throw that out on tape and everything. So in the meantime, I do want to make a couple other little plugs. One is something I put in the email that went out, and that is the Get CDC, CTC, that's the child tax credit. We're in this weird situation where there was a wonderful federal child tax credit last year where low-income families could get $3,000 in refundable credits for each child they had, or $3,600 for if the child is 5 or under. And we all know that one of the barriers for these families is filing taxes, because that is an unpleasant experience for all of us. And particularly for people who are stressed out by their income or other situations. And so while this isn't, there is conflicting opinions on how this, the best strategies, but I do know that if people haven't filed their taxes at this point, they're probably not going to. There are available people who can help, but one option is to go to this link that I'm also putting in the chat. And it's super simple. Now, granted, these people won't get the earned income tax credit if they're doing this, but they can get these thousands of dollars relatively easily if they haven't already filed their taxes. So that's my plug. And one other thing I want to point out, and I'm curious, I'll be curious what other people have heard about this, is all the power outages that are preemptively being put in place because of the wildfire danger. And I know that there's a news flash, a news alert that Pacific Power put out, and so I will, put a third link in because that's what I've been doing. And this outlines many of the counties that are going to be affected. And I know from internal chats, a lot of staff are being affected, but we also want to be aware, of course, of the Oregon families who are being affected by these power outages. And so I have to admit, I don't know a lot about the situation. If someone else has a comment or a question,
help,
I'd love to
James.
hear it.
Hi, everyone. Jamie Hintz here, she, her, hers. Yeah, over the past couple hours, some alerts have started to go out from county emergency departments. You might have gotten some on your phone. OHA has sent a couple internal and external communications about the upcoming wildfire threat and how power companies across the state are preparing. And one of those ways that they're preparing is planned power outages that could last up to 24 to 48 hours. So, so of course, my first thought was all of our communities that we serve and resources that we can help provide for them. So just be thinking about that. The other thing that is happening at 3 o'clock right after this call is the governor is going to give a press conference on all of this. So I'm going to put the link in the chat. So you all are encouraged to watch and just stay tuned and keep an eye out for more notifications as this all develops.
Yeah. If I could add just something real quickly, I have a friend who's a firefighter who's in the midst of it. Got a conversation going. He called me today. He's down by just, in this case, Oak Ridge. They have been told last night that there are huge windstorms, 40 to 60 mile an hour, coming through on Friday. They are already planning to evacuate the fire camp at that point. There's a very large meeting tonight in the town of Oak Ridge because Oak Ridge is in dire straits. They are directly in the pathway of this, and it could end up literally removing that town. And people are ready to go. They've been put out notices. They got notices today from their power supplier. It's coming. So it's pretty extensive. And, that's firsthand stuff I just got about 2 hours ago from a firefighter in place. So there's a lot of people going to suffer here. Don't mean to be a downer.
That's a
just-
full-on nightmare. Oh my God, it's
It
a
is.
nightmare.
Yeah, I mean, the city of the town of Oak Ridge is prepared to remove everyone and hope that they have a town left.
Yeah.
And as you may know, if you've been around Oak Ridge, it's kind of halfway up the mountain area there near the pass. And there are many, many people who have lots and lots of houses and cattle ranches and everything all the way up 7 miles from there. And it's all in the path. So it could be really devastating. I hope it isn't.
Al, I appreciate hearing about that. And I think it's good for us to aware the stakes are.
Pretty high.
Yeah.
Pretty high.
And I just wanted to mention that I'm with 211 and I'm actually not really in the emergency department, but I'm with the childcare team, but I do know that the public can call 211 for information about like where the wildfire region evacuations are, and then also for information about the power outages.
Thank you.
And I just want to jump in real quick and say, I'm from a firefighter family, and while we're talking about the damage and the, you know, the suffering for folks, I also think it's important to balance that with Oregon's renowned for its firefighting teams. And we get a lot of kudos from other states when we send our people out. And so we know they're all doing the best job they can down there. And we've got great people working on these fires in Oregon. So shout out to them.
Thank you, Dylan, and thank you, Carrie, for the reminder about 211. That's important for people to know.
There was a question in the chat about replacement SNAP benefits, and I don't think anyone from the SNAP team is on the call, but I believe there would have to be an application for to FNS to request replacement benefits. Sometimes they do that automatically, and sometimes there's like an application process. So I think once we sort of understand what is shaking out of all of this, I can connect with our SNAP manager to figure out what the sort of contingency plan is for submitting that to FNS as soon as possible.
Thank you, Jen. Yeah, typically we'll have a SNAP replacement policy in place, but yeah, I'm not as familiar with all the application process. So
yeah, sometimes they do it by zip. It just depends on how they decide to do it. Sometimes they do it by zip code. Sometimes they do it by county, which is much easier. So we'll see.
all right. Any other comments? All right. So I want to thank my co-host Susie Bautista for stepping in today, and thank you for this discussion and comments. We want to start doing this sort of discussion a little more often. I know this is a pretty heavy topic, this potential of wildfire, but just keep things in mind, and feel free to email me or bring them up or put them in the chat, things like this. We want to make this
James?
more for you all. Yes, Jen.
I'm sorry to interrupt, but someone from SNAP just messaged me that they should have a transmittal out on Monday on replacements and have already started the waiver request.
So you can see how the wheels work here, and we'll have some news for you all shortly. Well, at least Monday at the latest. But thank you all for your work. And if nothing else, we will continue on our Tuesday, and you can, if you have the time, watch the governor's press conference on this.